Hello, I'm so glad that you are here to learn a little bit about the Department of Health Services. I'm Dr. Christina Galli, the Director of the Department of Health Services for Los Angeles County. I'm so excited to share this video with you to help you learn a little bit about the Department of Health Services and our amazing programs and patients that we serve.
There's so many different leadership opportunities across the Department of Health Services. It's really just amazing. I've had the opportunity to work at Harbor on campus as a staff physician early in my career as an attending straight out of fellowship, and now assuming the role as chair of the Department of OB/GYN at Harbor UCLA.
Because DHS is such a large organization, but also an integrated organization, it provides opportunities for physicians to be leaders and to take part in projects that across all sorts of communities and all sorts of specialties and services that are part of DHS.
I'm a head and neck surgeon by training, yet I've worked in quality improvement, clinical operations, clinical informatics, and now I've had the privilege of helping to lead telehealth strategy.
For those of us that have a love or a passion for learning, for the art and science of medicine, this is a great place to work.
And I don't think there's another healthcare system in the country where I could have come right out of residency, said, I've got passion and skills, let me at it, and just had the doors wide open.
I'm in the Department of Internal Medicine and Infectious Diseases and an HIV specialist. I started in 1976 and I did my training for 5 years with all of you as an intern resident and infectious disease consultant.
You get to work with so many people that have gone through the process, that have done different things, whether it's academics, whether it's administration, and it really gives you a chance to find your way and to learn through the guidance of someone else that's had those experiences.
We collaborate with major research universities, the clinical programs, the research programs, experienced researchers, and younger researchers that just want to get on board.
The Department of Health Services is the second largest municipal public health care system in the nation. We serve about 800,000 unique individuals every year. We serve them in a variety of ways. We operate 4 acute care hospitals located strategically across Los Angeles County. We also operate 28 health centers.
My colleagues are bar none some of the most committed, bright, intelligent, technically skilled folks that you could ask to be working with.
The county has affiliation with the neighboring academic institutions, namely USC, UCLA, Charles Drew University.
These health profession students come to us and work alongside of us, and we can start to imbue our passion for caring for this population. And I think that that is so important for many of the physicians who come to work at DHS.
We also operate the Housing for Health network, which provides services, homeless and housing services for vulnerable individuals across the county. We also deliver care to individuals who are incarcerated in either the county jail system or juveniles who are located within the juvenile justice system, and the Office of Diversion and Reentry, which seeks to divert individuals from the LA County jail system into the community.
ODR was unique because it offered severely mentally ill individuals housing and wraparound services.
I get to work at an organization where I provide people with their basic human right, which is housing, and another basic human right, which is healthcare.
We take care of a very unique, very vulnerable, underserved patient population, largely comprised of marginalized social and ethnic groups. Many are non-English speaking. Many are at risk of homelessness or are homeless.
In all of these services, our mission is to support the most vulnerable people across the county, and we will do it for anyone, regardless of their ability to pay, how much money they make, whether they have insurance or not, where they were born, their immigration status, or any other factor.
Our physicians are able to really provide quality care without having to grind through patients trying to go as fast as they can or order as many tests as they can, because we're really there to serve the needs of that patient.
I worry about healthcare systems where the business interests are dictating a lot of patient care as opposed to what physicians think is best for their patients. So when I was choosing where to practice after residency, Los Angeles County Department of Health Services really appealed to me because it does have a unionized physician workforce with UAPD, and that allowed me to continue to have that power to advocate with the administration on behalf of patients to build the best healthcare system possible for our patients. from the perspective of physicians who really know best.
And really, we have so many different opportunities to work with wonderful patients and to really advocate for those patients and all of the care that they need.
I actually had my daughter going to the preschool that was located right on campus, and it's a wonderful thing that there are child care centers at a lot of the medical centers for all of the staff, and it was just wonderful to have that work-life balance right at work.
There are also quite a few loan repayment programs that are particularly unique here. And through that program, I'll be paying off all of my student loans fully within 3 years.
I've been here in the Los Angeles County system for 38 years. So it's a great place to take care of people and to really manifest what your heart's desire was when you became a physician, which was to take care of patients.
And I think if you are a person who will work towards a goal of serving your patients where they're at and really accompanying them in this journey for healthcare equity and really health equity, that is a reason to come work at DHS.
Take care of people that really, really appreciate your care. It's by far the most redeeming and rewarding thing of my day-to-day.
We have an amazingly talented workforce and we serve a diverse patient population. I'm thrilled that you're taking the time to learn a little bit about the Department of Health Services, and I hope to see you here one day soon.